Hey everyone, this is Kid of hardlensmedia. We are wrapping up this DSA live stream event that was being covered. It's about healthcare here in the United States and the situation that many Americans have to deal with the rising cost of healthcare. We are joined here today with one of the speakers that you all saw on our live stream, Kathleen Chambers. Kathleen, thank you so much for joining hardlensmedia. So essentially for our viewers who are going to be watching this and sharing this on social media, currently what is the real situation for Americans dealing with healthcare? Should they have a disastrous situation in which they're hospitalized and they don't have the funds to really pay the bills?
Well, the majority of people will be in a lot of trouble. I mean, it's only a small step before bankruptcy when the healthcare costs are so high and the insurance doesn't really cover everything. Even for the people who have insurance, most people now, 40% of people now are involved in a high deductible, which can be an average of $5,000. I've seen $7,000 for people's deductible for their insurance. Well, the people don't have $5,000. They don't have $7,000. And the cost of healthcare is so high nowadays that anything that happens can put people into bankruptcy.
Now, in comparison to other developed countries, where does the United States of America stand in regards to healthcare and the affordability of getting treatment?
Well, our healthcare costs in the U.S. are twice those of other countries in other developed nations. And we are the only country that doesn't cover all of the inhabitants. We also spend more as a part of our gross domestic product than anybody else does. We currently spend $1 in $6 spent in the U.S. is for healthcare costs.
Now, of course, money in politics plays a huge role in our government. What is the role of the insurance companies in regards to the policies they may want to have influenced or passed by our congressmen?
The insurance companies and the pharmaceutical companies are some of the strongest lobbyists in Washington today. And they are strictly self-serving. The insurance companies have a legal obligation to their stockholders. They have no legal obligation to the patients.
Now, of course, there are critics who say that single-payer health care is impossible to do here in the United States. It's going to cost too much, and it will ruin the budget. Essentially, what are your thoughts on that whole concept?
So when you add in all of the taxes that we pay, we currently spend 2/3 of all the money to finance our health care is already being financed by the government. 1/3 is through insurance. And the amount that the public funds pay are now more than the health care costs in any other country. So we're already paying for the health care costs. We're just not getting the right services.
And what's really necessary for us to get single-payer health care in this country? What are the steps to really get it actively passed? And who's really halting that from happening?
So everybody has to go to their representatives, their senators, their congresspeople, and get them to turn over to our side because they have to stop being the puppets for these insurance companies. They have to start looking at the health of the nation because we're very sick. We're a very sick nation.
And real quick, where can our viewers and subscribers learn more about your organization, and where can they find you guys on social media?
So we're called the Community Forum for Medicare for All. And we're just a group of people from different progressive organizations that join together so that we can educate people about Medicare for All.
Well, thank you so much for joining us, Kathleen. All the best to your organization, and peace, everyone.
You're watching Hard Lens Media.